The processes by which our body converts what we eat and drink in energy are called metabolism. And a key step for our metabolic health is being able to switch between our main body fuel sources, that are carbohydrates and fats. However, in the modern world, that metabolic switch often gets stuck, and that can lead to health problems such as obesity, diabetes, chronic fatigue, metabolic syndrome, and further complications. Metabolic Health Solutions have developed a clinical device that can test your metabolic switch breath by breath and use that as a key parameter to tailor personalized lifestyle interventions and monitor health progress in their clinic. Metabolic Health Solutions wanted to go further and use all the know-how they acquired to create an artificial intelligence clinical assistant. And they brought together our iPREP team, composed by a multidisciplinary group of PhD candidates in social media analytics and blockchain, economics, biochemistry, and applied artificial intelligence to make it happen.
Artificial intelligence has, with all its promises, significant challenges associated with the perception that our reality, lifestyle, and behaviour truly reflects the outcomes related to our online keys. Part of Metabolic Health Solutions' success has come from the dedicated clinicians who have mind-mapped algorithms that has successfully resulted in their patients' weight loss. And thus, to determine feasibility of their vision, MHS tasked us to help develop Enable, an expert browser and AI-based database with an evidence-guided machine learning tool for personalized, on-demand clinician support that will provide an individualized snapshot of metabolic flexibility with a near real-time patient feedback capability backend and an AI-integrated diagnostics, zero-trust, scalable front end.
Metabolic Health Solution aims to work on metabolic twin concept, which is based on the assumption that two or more patients can belong to a group and metabolically behaves in a similar fashion. To investigate this concept further, we have worked out a plan for expert browser where any new patient enters into the system. His information is then analyzed and classified into a metabolic family. Once we know his metabolic family, built-in prediction model for each family will uncover predictions for him. An approach is designed to build a prototype for expert browser, which is developed in 2 phases, where phase 1 uses clustering techniques and phase 2 discusses prediction model.
So we use a clustering algorithm to identify your metabolic family. It just splits clients into different groups. If you're in the right group, for example, well, the algorithm could recommend you to follow a low-carb diet and explain why this low-carb diet is good for you.
Prediction model makes sense of data by identifying patterns and insights using past data. We utilize prediction techniques such as random forest and logistic regression to predict patient outcome. Patient outcomes can be improved sleeping pattern, weight loss, improved energy levels, waist loss, and many more.
For us to do that, we had to crunch a lot of data, and we've seen areas of improvement for Metabolic Health Solutions to store their data better. So we've proposed a database design that will help them run our algorithms, but also run their platform in optimal conditions, that will help them develop algorithms faster and also reduce processing costs. So let's sum up. We have discussed with clinicians, reviewed the metabolic health literature. We've developed a strategy that will gather data and find some metabolic twins. We've done all that to report that the Enable platform is feasible, provided some clinical validation, and we'll be glad to see Enable taking out in the future. Thanks a lot.